You almost fainted and crawled on the ground. Didn't you check? Why not?
Hi, we are Dr. Friends.
Please like and subscribe. Setting the alarm and leaving comments really helps us create videos that benefit you.
A lot of people ask about orthostatic hypotension.
Yes, many.
Feeling dizzy when you stand up suddenly?
Isn't this something our director was asked about recently?
We asked people on Dr. Friends Instagram to send in their questions, and the most common was about orthostatic hypotension. So we made this content for our helpers. Can you explain it?
Harry once had a textbook case of orthostatic hypertension. It was the day after our wedding and we drank a lot.
That's right.
After drinking a lot, he sat, went to the bathroom, didn't return for a while, then came back pale, saying he almost fainted.
You didn't check.
No, he told me.
He crawled back.
No, he walked back in and said he fainted.
Oh, so Kai.
No, because
Ding ding. You have orthostatic hypertension.
this is typical. Drink water and lean back a bit. It often happens when dehydrated, especially in women. Standing draws about 500 to 1,000 milliliters of blood to your legs.
When standing,
Because blood pools.
Right. But the moment you stand up, your autonomic nervous system tries to maintain homeostasis. Your heart rate increases, heart contractions, and blood vessels in the lower body constrict to send more blood to the heart. The heart pumps to the brain to maintain function, but if blood flow to the brain drops suddenly, you can feel dizzy and might faint. This is orthostatic hypertension, common in dehydration and when blood vessels dilate.
When they dilate?
In summer, when you go to a sauna or drink alcohol, the blood vessels usually open up. In these situations, if we measure blood pressure in the hospital, it often drops significantly within 5 minutes of standing. The heartbeat should compensate, but sometimes it fails.
it should compensate immediately to raise blood pressure.
Right? Because that doesn't happen, most cases are mild. But for those who are severe, they might actually faint.
You might faint.
It can be quite dangerous at times.
Many visit ENT clinics for these symptoms. When they feel dizzy, people think of ENT. That's right, but many have orthostatic hypertension symptoms. Often, you can tell just from the medical history.
That's right.
When you stand up after sitting, something happens. I'm not very knowledgeable, so I just say try to stand up gradually instead of all at once. Who wants to clean toilet?
Slowly,
Slowly.
It's hard to do.
It's not easy. I suggest doing that and then going to an internist, as they might have more specific advice.
if you feel dizzy when standing, don't force it. Just sit back down and rest.
Exactly.
Right.
Most try to push through dizziness and stand.
They walk.
I tell them to sit back down and rest if dizzy. Maybe an internist has other methods.
We advise avoiding dehydration. Many people get dehydrated from coffee and alcohol, so you should drink plenty of water, about 2 liters daily. Orthostatic hypertension is often worse in the morning. As Nakjun mentioned, you should rise gradually. Keep water by the bed, drink it first thing and get up slowly. Make it a habit to take your time getting up, especially in the morning. And when standing from sitting, people often feel dizzy. Blood is pumped to the heart by muscles, and weak muscles increase vulnerability to orthostatic hypertension. If you feel this way while sitting, you should engage your calf muscles before standing to help improve circulation and reduce dizziness. Engage your leg muscles a bit. Moving them can help. The best thing is to exercise regularly.
Squats.
Squats or running. Strong leg muscles pump blood to the heart better. Women experience this more due to less muscle.
They have less muscle than men.
They lack muscle mass and often have anemia or bleeding issues due to menstruation, making them more vulnerable. They need lower body exercises, but women often neglect these.
Men don't focus on legs.
That's right.
People focus on the upper body.
So doing exercises like squats, especially for the calf muscles, can be helpful.
How about wearing stockings?
Compressions.
In severe cases, especially for women, Compression stockings are sometimes recommended, but they usually need to be high-waisted. It's advised to consult a doctor about them, and medication is also an option. This is really for when daily life is very difficult, or there are side effects like increased blood pressure or fluid retention, so it's best to consult a doctor before deciding.
I'm also curious about orthostatic hypotension. If someone is diagnosed and now adjusting lifestyle habits, could orthostatic hypotension potentially lead to any serious complications?
For most young people and in mild cases, it's generally not a concern.
No need to worry if mild?
It's usually not an issue for healthy young people. However, those with diabetes may have neuropathy, and Parkinson's can be involved. Certain medications like those for blood pressure, because it too, if it recurs in older adults, it can be problematic.
Anyway, if you feel dizzy and fall,
That's right.
fatal injuries,
For older adults with osteoporosis, it can be really dangerous, but for mild cases, it's not a big concern. However, dizziness from lifestyle habits could lead to falls. Older adults are at greater risk, so maintaining lifestyle habits and regular exercise is crucial.
I should do squats.
Do squats.
Do squats and stay hydrated. Exercise is more important than you think. Especially with squats, some people expect immediate improvement, but that's not the case. While immediate symptoms might improve, squats need about 3 months for muscle and hormonal improvements. You must exercise consistently to see results. You shouldn't expect changes after just a week. Give it time and you'll notice improvements. Thank you.
Thank you.
Thank you.
If you drink a lot, drink plenty of water.
Exactly.
The first thing I told Harry was to drink water.
He drinks it like water.
That's why he gets confused.
We should have been clearer.
We should have told him it's alcohol, not water.